everyone, and welcome back to my channel. My name is Anyen and welcome to the Fawn Farm. So today I have a yet another very special guest for you guys. I don't know if you guys can guess. Just guess in the comments if you don't know who you think I have here today. Before we get started, I'm gonna let her introduce herself, and then from there we'll go on into what this video is about.
Hi, good afternoon or good morning. This is part of the Fawn Farm, and my name is Philomena Fawn, and I'm a pharmacist at Comcare Pharmacy, and we just thought that we could put something together to sensitize the community about what is going on now with the COVID-19, and as pharmacists, what our role is and how we've actually stepped into the community now to see how we can help fight the COVID-19 that is just it has just taken us on our way, and we don't really know exactly how it is, but we're just doing our best as healthcare professionals to see how we can help our patients, help ourselves to stay safe.
Before we get into what this video is really about, this is my mom, in case you have not already guessed, and yes, she's a pharmacist. So just as a disclaimer, we don't want this video to be interpreted as us being happy that, you know, lives are being lost, but kind of like to look at the other aspect of it, and that's the fact that pharmacists and the career of pharmacy is now being valued, and the fact that we're able to bring value to the outbreak of COVID-19 is something that we kind of want to shed a light on. So now, just to kind of get into it, we're going to talk about how coronavirus is actually helping to grow the field of pharmacy and to, you know, just get the word out there and grow the value of pharmacy. And that brings us to our very first point, which is that the value of pharmacy as a career is now being recognized.
Yes, yeah, and as you just said, we are part of the essential workers that that have to stay open together with the hospitals, grocery stores, and at this time, I really see how it is very important, because if people are prescribed medications, if we don't stay open, they can't get those medications. So we are really seeing a lot of people running into the pharmacies now, which is not what was happening a few months back.
Yeah, so I personally don't work in a pharmacy right now, but I know that for pharmacists or student interns, pharmacy interns, you guys are really busy right now, right? You guys are working overtime, extra hours, and just like dealing with everyday public, because with everything that's going on, everyone is now trying to stay healthy. Everyone is getting early refills, emergency refills, because of the quarantine. Nobody really knows how long the quarantine will last. So everyone's like trying to stock up on medication, and, you know, for those that have chronic health conditions, those are all things that they're trying to take care of now.
Yes, and I really see that the number of people rushing in to get vitamins, they see the importance of vitamins at this point, because they're trying to build their immune system, which is something that people really like careless about before. So you see they're rushing in vitamin C, vitamin D, they're talking about zinc, they're talking about hand sanitizers, Clorox wipes to clean the environment, which is it was amazing. It is really amazing how people are coming into realization as to how you have to actually keep yourself healthy and prevent from getting getting sick.
Yeah. So actually, coronavirus is helping a lot of us, right? Because I also started taking my vitamins daily. I started drinking water more often because nobody wants to be sick at this point. Going into our second point, which is the fact that physicians are now booked and busy, so that leaves everyone running to the pharmacy. Everyone is running to get, like we just mentioned, to get medications. People are coming for consultations, just everyday illnesses that you probably maybe would go see a doctor for. But now that, there a lot of the physicians now are dealing with the outbreak of COVID-19, a lot of people are coming to the local pharmacies to get over-the-counter recommendations and consult pharmacists about how to take their medications, and people are actually trying to be compliant now, whereas before maybe compliance was a really big issue. I mean, we don't have any research to prove this, but just kind of like the fact that everyone's now trying to stay healthy is kind of feeding into that aspect of, okay, let me be compliant so that my immune system is healthy, so that I don't get coronavirus. So everyone is now looking at pharmacists as valuable professionals in the healthcare field.
Yeah, I see that very. We see that very often in the community pharmacy now, because we see patients coming in to consult or ask for over-the-counter recommendations, as we mentioned earlier, because it's the healthcare is drifting more into telecommunication, teleconsultation with the physicians, because they're limiting the patients from getting into doctors' offices, getting into the emergencies because of the quarantine. And because it's not everybody that feels comfortable going over the telephone or going video calls with their doctors. First of all, like the old people, they're not really like so much into all the technology.
Yeah.
So they have to walk. The only place that they have at this point now is like the pharmacy, to come into the pharmacy and talk to the pharmacist and ask for recommendations, and maybe request them to call their doctor for refills. And right now, there's authorization for us, for pharmacists, to give 30-day emergency refills, while we can contact the doctors later for our prescription, especially for chronic conditions like hypertension, diabetes, and high cholesterol, just regular medications that patients have been taking for health maintenance. So we really see our value in the community, because we see that we can actually have an impact on the health of our of members of our community, because there's so many things that we are able to offer. But the one question that I ask at this point is, like, so many people are rushing in now for flu shots, which is something that we have been advocating for. Come and take your flu shot. You talk to even family members. It's surprising. Family members, you talk to them about flu shots, they don't even want to listen. It's at this point that everyone wants to stay healthy, because knowing how the COVID-19 is spreading, and knowing how it affects it will affect you more if you have a weak immune system. Everybody is trying to build a strong immune system. They want to take flu vaccines. They want to take their over the counter. They want to take vitamins to build their immune system. So I really feel fulfilled, the fact that I can actually add value to the health of the community.
And just to say, like, pharmacists have always been the most accessible, healthcare professionals, right? Because you can find your nearest pharmacy. Like, most people have a pharmacy within 5 miles of where they live. But that's not something that was maybe as recognized. But now it's like everyone is aware of the fact that pharmacies are really close, and that's even within the outbreak. I mean, prior to the outbreak, pharmacists have been the most accessible, because you can always call the pharmacy. You can always just walk right in and ask to speak with the pharmacist. I mean, they've always been accessible, but even in the midst of coronavirus, they still remain the most accessible, right? Because, like she mentioned, now doctors are doing online or telephone consultations, and a lot of doctors are busy just with trying to get testing kits and all of that. Not to say that all of that is important, and we need that. So it's just like recognizing that now pharmacists are able to bring more value. They've always had value, but it's like coronavirus is making it more, more recognized. you're able to see it more. And once more, pharmacists are at the very front line. Similar with people at the grocery store, because anybody walks into the pharmacy with symptoms, without symptoms. Like, you don't know if someone who just walked in has coronavirus. Like, it's open. The doors are open to anybody. They're really like now dealing with people with or without coronavirus, people who might be having a sore throat and come and need something, don't know they have coronavirus. So it's just like that risk is also there, but they still remain accessible. And this kind of brings us to the third point of why pharmacists need provider status. So I think that coronavirus is just kind of highlighting that aspect. And I believe I also read somewhere about Florida and how Florida just passed a legislation, I'll link it down below, a legislation that's allowing pharmacists to prescribe and to basically consult, diagnose, and treat like influenza and streptococcus, right? I think.
Yes, diabetes, hypertension.
Yeah, and diabetes, and manage
HIV.
these chronic conditions like diabetes, hypertension, COPD, asthma. Those are things that, you know, I am currently being trained to do, but pharmacists are trained to do. And just the fact that it needed coronavirus for people to realize that, okay, we do have that we do have that qualification. I mean, that's not like diagnosing cancer, obviously, but it's like those are, you know, things that people come and get immunized for, and chronic conditions, being able to manage that. So that's another thing that has been added to what pharmacists are able to do, at least in Florida. So hopefully, I know that there's some legislation being passed. I know that APHA wrote a letter amidst this whole crisis asking for, just kind of re-emphasizing the need for provider status because of the outbreak. So
yeah, and also I heard you mention about hazard, that the pharmacists are at forefront risk because they see customers walk in, you don't know if they have coronavirus, they don't have symptoms or they have symptoms, but they come to ask for something that they think could help them from the pharmacist. And recently I read an article for Walgreens pharmacists advocating for hazard pay, which I think is something that should be considered for pharmacists, nurses, healthcare workers,
grocery, even
yes,
people
even
that
grocery
work
stores, that people that work in the grocery stores, because truly people have to rush to the stores to get food, and that time you don't even know whether you have it or not.
Exactly.
You don't know who you're meeting in there, who has it or not. So I see that the companies that operate all these facilities should, or they should think about the risk that these workers are exposing themselves to in order to help in the community.
Alright, to conclude this video, we just kind of want to encourage you guys to stay up to date with what's going on in the news. We encourage you guys to follow the president's 15-day plan to slow the spread of COVID-19. Look up on the CDC website. Just try to stay healthy and try to stay indoors. Because one thing to remember is that it's not just affecting elderly people, it's affecting young people as well. And as much as we try to prevent the spread, or as many precautions as we try to take, is how we're able to prevent others from being affected.
Yes, and so we should serve as advocates for each other so that we abide by the 15-day guidelines that the president mentioned, or that the president put in place, so that all of us and people in our community can stay safe, so we'll be able to contain this disease instead of making it spread as much as it spread.
Alright, thank you guys so much for watching this video, and see you guys next time at Fun Farm. Bye!